Why Medicare Part D premiums are set to rise in 2026. Prepare for a financial hit. Medicare Part D premiums are set to skyrocket next year. But here's where it gets controversial. The Centers for Medicare and Medicaid Services, CMS, has just dropped some alarming data that's sure to ruffle feathers. Let's dive in and explore what this means for you and your wallet. Published on July 30th, 2025, this information is fresh off the press and crucial for anyone relying on Medicare Part D. The CMS released preliminary data on Monday, and it's not pretty. The average monthly bid submitted by insurers for 2026 prescription drug plans has surged by a staggering 33% compared to last year. This means that the cost of prescription drug coverage is about to get a lot more expensive. The average national monthly bid for 2026 stands at $239.27, a significant jump from previous years. And this is the part most people miss. The base beneficiary premium, which is the amount beneficiaries pay out of pocket, is also on the rise. It's set to increase by 6% to $38.99, hitting the maximum allowable increase by law. But why the sudden spike? Insurers are facing higher costs, and they're passing those costs directly to consumers. The CMS has also announced that it will continue a voluntary demonstration program aimed at stabilizing Part D premiums, but with some tweaks. Ryan Langston, an analyst at TD Cowen, sees this as a positive move for health plans. But what does it mean for you? Let's break it down. Medicare beneficiaries have two main options for outpatient prescription drug insurance: enrolling in a Medicare Advantage plan that includes drug coverage, or opting for a standalone Part D plan that supplements traditional Medicare. Insurers work with the federal government to manage these Part D plans. Every summer, health plans submit bids to the CMS, estimating their benefit payments and administrative costs for the average Medicare beneficiary. Regulators use this data to calculate the nationwide average bid and the base premium, which is what beneficiaries end up paying. But here's the kicker. The CMS also provides a direct subsidy to plans, filling the gap between the average benchmark and the base premium. For 2026, this subsidy is set to increase to $200.28, up from $142.67 this year. So what's driving these increases? Healthcare costs are on the rise, and pharmacy expenses are a big part of the problem. Medications like pricey GLP-1s are contributing to the surge in costs. In response, the CMS has taken unprecedented action to hold insurers accountable for these premium increases. They've been negotiating bid terms and conditions and denying bids that include significant cost increases or benefit reductions. But is this enough? The CMS has also made some changes to. Initially, the demonstration included a uniform reduction of $15 to the base beneficiary premium, a yearly increase limit of $35 on a plan's total Part D premium, and narrowed risk corridors. For next year, regulators will decrease the uniform reduction to $10, increase the Part D limit to $50, and cut the narrowed risk corridor thresholds entirely. The goal? To gradually return the program to regular market conditions. But will this work? And what does it mean for you? The CMS is betting on a return to market stability, but some experts are skeptical. What do you think? Will these changes help stabilize premiums, or are we in for another round of skyrocketing costs? Share your thoughts in the comments below, and let's get the conversation started. And this is the part most people miss. As healthcare costs continue to rise, it's more important than ever to stay informed and advocate for your rights as a consumer. Don't let these increases catch you off guard. Stay tuned for more updates, and be sure to voice your opinions in the comments. Your input could make a difference in shaping the future of Medicare Part D. Medicare Part D crisis. What you need to know for 2026. A ticking time bomb looms over Medicare beneficiaries, particularly concerning their prescription drug costs. Millions of individuals relying on Medicare are facing a potential shock, as the costs associated with their prescription drug coverage are set to spike. Despite the 2025 Medicare Trustees Report, https://www.cms.gov/OACT/2025, declaring Part D prescription drug coverage to be in a satisfactory financial condition. The Centers for Medicare and Medicaid Services, CMS, is scrambling to implement emergency measures to curb the anticipated premium hikes for 2026. Stay informed. Sign up for the Street's free daily newsletter. https://www.thestreet.com/newsletters. This situation highlights the precarious state of the program and the urgent need for beneficiaries to take proactive steps this fall. The surge, understanding the 2026 Part D premium increases. Contrary to the trustees' optimistic outlook, insurance companies have proposed significant premium increases for 2026. The National Average Monthly Bid Amount, NAMBA, https://www.cms.gov/NBANA 2026 Medicare Part D Bid Information /Premium Information Parameters has jumped from $179.45 in 2025 to $239.27, suggesting that base premiums could rise to levels that many Essentially, it represents the average cost estimated by insurance plans to provide basic prescription drug coverage for one person per month. Weighted by the number of enrollees in each plan, CMS takes action. Emergency measures and plan rejections. For the first time, CMS has rejected some standalone Part D plan bids due to unacceptable, significant increases in cost sharing or reductions in benefits. Additionally, the agency has extended its emergency premium stabilization demonstration, which places a cap on how much monthly premiums can increase. However, this cap will rise from $35 in 2025 to $50 in 2026. The Inflation Reduction Act, a double-edged sword. Much of the current turmoil can be attributed to the Inflation Reduction Act, IRA. While the IRA aims to benefit seniors by capping out-of-pocket drug spending at $2,000 annually, increasing to $2,100 in 2026, and enhancing government liability for catastrophic coverage, it has inadvertently led to higher deductibles, increased coinsurance, and volatile premiums for the majority of beneficiaries. According to the Kaiser Family Foundation, https://rtww.kff.org/Medicare issue brief / a current snapshot of the Medicare Part D prescription drug benefit. 85% of Part D enrollees faced deductibles in 2025, up from 67% the previous year. Coinsurance, the hidden threat. One of the most significant changes is the shift from flat copays to coinsurance. Instead of paying a fixed amount, some enrollees now face a percentage of the drug's retail price, typically ranging from 25% to 33%. This change can significantly increase out-of-pocket expenses, especially for high-cost medications like Eliquis, which can cost over $700 a month. Under a 25% coinsurance, the cost would be about $178, and 33% would be around $235, compared to the usual $47 copay for preferred brands. Federal interventions, a temporary fix. To mitigate the impact of these changes, federal interventions are playing a crucial role. However, the stability in premiums is largely artificial, supported by temporary subsidies and bid caps. Beneath the surface, the market is under strain. With fewer plan options and increased market concentration, the top 5 firms now control nearly 75% of enrollment. Shrinking safety nets, the impact on low-income beneficiaries. Low-income beneficiaries are also affected, with enrollment in the Low-Income Subsidy (LIS) program dropping from 13.7 million to 13.1 million in 2025. This decline, partly due to Medicaid unwinding, means fewer people are protected from the volatility. Cheers! Your action plan, navigating open enrollment. With open enrollment for 2026 coverage starting on October 15th, inaction could be costly. Most beneficiaries tend to stick with the same plan year after year, but this complacency is now risky. Reshopping, a non-negotiable step. Mary Beth Franklin, a certified financial planner and Medicare expert, emphasizes the importance of reviewing and potentially changing your Part D drug plan. Beneficiaries must reshop their plans during open enrollment this fall, she advises. Make decisions based on your specific drugs and dosages, not last year's premium. Practical steps for beneficiaries. 1. Review your annual notice of change, ANOC. Plans will send these notices in September, detailing changes to premiums, deductibles, formularies, and pharmacy networks. Small changes can have significant financial impacts. 2. Use the Medicare Plan Finder tool, available at Medicare.gov starting October 1st. This tool allows you to input your prescriptions, dosage, zip code, and preferred pharmacy to compare total annual costs across plans. Focus on total out-of-pocket costs, not just the monthly premium. Hashtag navigating fewer choices. Market consolidation has reduced the number of plan options, leaving less room for error. Melinda Cahill, co-founder of 65 Incorporated, notes that the average number of plan options has decreased from 22 at the end of 2024 to just 14 in 2025. Hashtag real savings. The benefits of comparing plans. Comparing plans can lead to substantial savings. Cahill reports that some clients have saved an average of $8,000 by switching plans, with some cases exceeding $100,000 over time. Assuming that a plan that worked this year will work next year is a mistake, she warns. Seeking professional guidance. Professional assistance may be harder to come by, as several major carriers have reduced agent commissions for Part D plans. If you need help, schedule it early, or consider paying a professional for an independent review. Off-plan options. Exploring alternatives. While having a Part D plan is generally beneficial, you don't have to use it to pay for your drugs. Marcia Mantell, president of Mantell Retirement Consulting, suggests checking off-plan options like GoodRx, Single Care, AARP's Discount Drug Card, Amazon, and Mark Cuban's Cost Plus Drug Company. https://www.thestreet.com for potential savings. Considering Part B premiums. In addition to Part D changes, standard Part B premiums are expected to rise sharply in 2026. Factor these costs into your overall budget. Why this matters to you. Medicare Part D is entering a period of unprecedented volatility. While federal interventions provide temporary relief, the underlying market remains fragile. For most beneficiaries, the best defense is active participation in open enrollment, comparing plans, understanding coinsurance exposure, and ensuring your plan aligns with your needs and budget. Failing to act could make 2026 the most expensive year yet for your prescription drugs. What do you think about the changes in Medicare Part D? Are you planning to review your plan during open enrollment? Share your thoughts in the comments. 7. Medicare premium set to skyrocket in 2026. What you need to know. Medicare's financial squeeze. Brace yourself for shocking 2026 cost increases. Attention seniors and healthcare planners, get ready for a financial roller coaster in 2026 that could dramatically impact your retirement budget. The latest projections from the 2025 Social Security and Medicare Trustees Report reveal a stark reality that every older American needs to understand. The Medicare premium tsunami. What's really happening? Imagine watching your healthcare costs surge unexpectedly. In 2026, that's exactly what's coming. Medicare Part B premiums are set to jump a jaw-dropping 11.6%, escalating from $185 to $206.50 per month, the most significant dollar increase we've seen in 4 years. But this isn't just a number. It's a potential budget breaker for millions of retirees. Breaking down the numbers, more than just premiums. Let's dive deeper into the financial landscape. Part B coverage breakdown. Monthly premium increase from $185 to $260. Annual deductible climbing from $257 to $288. Coverage includes doctor visits, outpatient care, and select home health services. Part D prescription dynamics. Base premium projected at $38.99. Standard deductible rising to $615. Out-of-pocket drug cap increasing to $2,100. But here's where it gets controversial. The Social Security cushion. Social Security's cost of living adjustment, COLA, is estimated at 2.6% to 2.7%, promising an average monthly benefit increase of about $54.14. Sounds promising, right? Not so fast. Here's the part most people miss. the rising Part B premium could devour 40% of that gain, leaving you with a mere $32.66 net increase. The hidden impact: income-related challenges. Retirees with higher incomes face an additional twist: potential IRMAA, income-related monthly adjustment amounts, surcharges. These can significantly inflate Part B and Part D costs, creating an even more complex financial puzzle. Strategic preparation: your financial shield. With Medicare open enrollment approaching October 15 to December 7th, here are your must-do financial maneuvers. 1. Income forensics. Meticulously review your 2024 income, which determines 2026 premium adjustments. 2. Tax strategy. Consider Roth IRA conversions to minimize future taxable income. 3. Plan optimization. Carefully evaluate Part D and Medicare Advantage plans. 4. Stay informed. Track official premium announcements from CMS this autumn. The bottom line: proactive planning is your best defense. Medicare costs in 2026 are not just rising, they're potentially transforming your retirement financial landscape. While Social Security offers modest increases, premium hikes threaten to outpace those gains for many seniors. Provocative question for readers: are you financially prepared for these Medicare metamorphoses, or will you be caught off guard? Stay vigilant, stay informed, and most importantly, start planning now. Your financial future depends on the actions you take today.